So I think everyone would agree that we've just had an extraordinary conversation with uncommon candor and with, actually, if you stop to think about it, as I know you all did, some real challenges to all of us. And I just wanted to capture a couple of things that I heard and pose a question then to you, which I think will resonate with those challenges the panel has already put forth, but of course they're free to weigh in as well. But let me just start first with an observation about a task force, which is not exactly the most exciting thing in the world, but there is a task force that just released its report at Harvard, and the title of it was Diversity, Inclusion, and Belongingness. And in some ways, I think that's what we're talking about, is the experience of belonging at work, belonging in our community, and the opportunity to bring our whole selves to work. Now, that's great when our whole selves include just the joyous and happy parts of our life outside of work. But of course, the challenge is, as we've already heard, so many of the lives of our students, of our practitioners, and of leaders also include a variety of unhappy experiences, stressful ones, and mental health issues and emergencies, from the opioid crisis that's affecting so many communities to domestic violence, child abuse, and so forth. So we know that there's a challenge even in bringing our whole selves to work. But let me just pick up on three quick observations from the panelists and what they've put forth as, I think, a challenge. Tracy invited us to think about rewiring our whole systems. And at this very day, my husband has been managing a rewiring project at our home. So we know that even that involves a lot of work in taking things apart in order to put them back together in a better way. And then Jason, in using a change management model that's focused on Kubler-Ross, is essentially taking us into the observation that when we change systems, we actually are asking people to bear losses. And when we take 60 seconds to do one thing at the top of a meeting, that 60 seconds has to come from somewhere. So even there's a bit of a loss that needs to be negotiated. And some of those losses are even more profound. And then Angelo brings, and also Sandra, bring to us another set of issues, which is a complicated question about over-reliance on resiliency. And even maybe the title of this topic, are we alleviating stress? Or are we actually trying to help people to bear stresses more effectively with less trouble to us, et cetera, et cetera? So those are three challenges that I think have come out of the panel so far. So here are my two questions just to kick things off, but I know that you have other questions and you should feel free to raise those questions and or to contribute your own perspectives to make this as interactive as possible in the minutes we have left. So my first question is, we've heard a lot about interventions that any of us could do tomorrow, if not this afternoon. We've also heard a lot about promising practices across many systems. So this is the question, to what extent do we sponsor more innovation by casting a broad net? Or might there be value in committing across institutions to a set of most promising practices and putting our muscle behind those? So that's one question. And then the second is, and this goes to Jason's challenge to us, it's if we're going to make some of the changes that everyone in this room is committed to at whatever part of the system you're working with, whether you're a student or a line clinician or a leader or a policymaker, what would you have to ask people in your system to give up in order for these changes to be able to develop some traction? So that's my question to all of you as well as to the panel. And let's open things up.
I'll dive in. Did you want to start with us or the audience?
Sure.
I'm fine not to dive in.
Well, why don't you dive in,
Okay.
and then we'll we'll get another person. after
Okay,
that.
just real quickly, the first question, from my perspective, but this is also a reflection of my personality, so I'm not sure it's a wrong. But I do feel like, I mean, just listen to the wisdom in this room, and I've only been here this afternoon. I don't think we need more innovation. I think we need to do it, to model it, and to put our oomph behind it, as you said. That would be my vote.
I was really struck by this idea of rewiring, and this is for, I guess, Angelo and Sandra. Angelo, your anecdote about the Monday to Friday, it really touched me because you were in a position of power. You had, to your point, Kimberlyn, a lot to lose by being vulnerable. And in your words, if I think I heard you right, that was not vulnerability. That was strength. How do you message that to other people, other leaders, either public sector or institutional leaders? Because in my view, that is a demonstration of authenticity and real power.
Yeah, for me, it's really about, we have so many false dichotomies in our society that we buy into. It's, and one of those dichotomies is if you ever have a moment of weakness, then you're forever perceived as weak. And it's not buying that notion and just sort of say, if I have a moment of weakness, I had a moment of weakness. That's all it was a moment. That doesn't define me. And if one of my colleagues have a moment of weakness, it doesn't define who they are. And it actually it's my job to support them through that moment of weakness, if in fact it is, rather than to judge them. And I'm going to do that for them because when I have my moment, I would like for them to extend the same thing to me.
You know, the question about whether or not we use a broad net or promising practices, it's not either or, because culture reflects differences in how people receive even the promising practices. So we really, in social work, we talk a lot about starting where the client is. So I think, the response to that is that we really have to sort of tap into what's going on with that person and with that individual. So the promising practices for one organization may not work for another organization. So I think we have to get in touch with our particular organizations and the systems and then respond appropriately there rather than to decide because this worked in organization A that it will work in organization B. And because your constituents and stakeholders may be very different, even though we may share the same profession, we are very different. So back to the wiring, we're wired differently, and we have to respect that.
And the root cause may also be different, right? So the solution
Exactly.
may not be the same. And the other thing that I am trying to be mindful of from my role as a leader is part of our challenge as an organization, and it may be at all of your organizations, part of the stress and the difficulty is there's just so much right now, right? There's just so much. And so we have to be very mindful that we don't go and then say, oh, and now you need to be resilient. And now you need to do something for you and well-being so that it actually feels like what we're trying to accomplish is an additional burden on individuals and it has the opposite result.
Yes.
I looked this up just to make sure I didn't misquote her, but I think we need to look at our language in particularly. I've tried to stay away from the word weakness, and the person who transformed my language was Brenda Brown. Mm-hmm. And I just wanted to read that short quote from her book, Daring Greatly. Brenda Brown says that vulnerability, which is uncertainty, risk, and emotional exposure, that vulnerability is the birthplace of joy, love, belonging, courage, empathy, and creativity. And I think that the power of vulnerability, if we could turn it around and not see it as a negative, but the power that's there. And so I don't use that word weakness anymore. I use the vulnerability because of the power in it.
Yes.
I'm Brenda Ziegler from the University of Washington. I have implemented programs to try to improve team outcomes, and part of it was around resiliency, but what I've learned has something to do with what Jason said, is when you implement something to try to improve or make a difference, there is a de-implementation that's going on at the same time.
Absolutely.
And there's now even a literature around de-implementation processes. So somebody is losing, somebody is changing. And for all the behavioral scientists in the room, we know that's the most difficult thing. So it's helped me now as I move forward, like with what you suggest with best practices, is there's going to be some de-implementation of some behaviors or processes that are currently in place and have been there maybe historically. And so not expecting to make these happen quickly or easily.
Yes.
This one. The whole person concept that Tracy discussed links very much to some of the discussion we had earlier in the morning about focusing on healthcare versus sick care. And one can envision that in the VA, the incentives are aligned in terms of really keeping people healthy and doing the preventive things and other things so that they don't have to come to the system and seek treatment. So how would this work in an environment where physicians may be under pressure to bring in revenue, they may be incentivized to do more procedures and more surgeries, and so how would it work in a system where the incentives may not be aligned in terms of really keeping people healthy?
Right, so I'll try to answer that quickly because it's a very, very good and important question. I think fundamentally, I think we have to do really the demonstration of outcomes, costs, utilization in the VA because of what you're saying. So we have the opportunity. That's why I left Duke and joined the VA, right? Because we actually can model this. We have 18 facilities that are doing the whole system right now. And we're doing standard kind of outcomes across, including well-being of clinicians and looking at all of it. So our hope is that we're going to learn a lot. It's not like we have the answer and it's perfect. I don't in any way mean to communicate that. But we will learn a lot, and what we are seeing is that physician burnout and the people who are engaged in this are phenomenally more fulfilled and happy and healthier in their own life. So we're pretty confident that good stuff will be demonstrated. Once we demonstrate it, including decreased utilization, because in our system, the folks that are choosing this most frequently, chronic pain patients, mental health issues. I mean, these are high utilizers who aren't getting their needs met elsewhere. So our hope is that we can actually give back to the private sector and academia a lot of information it needs to say, oh, this is actually not just the right thing to do, but the smart thing to do too. So I think it will take time. It's large system transformation takes so long, but I think we can provide that. I hope, that's my hope. Thank you for that question.
I just want to make sure we're all aligned too, because our red lights are blinking that we have 6 minutes left, but the schedule says we have no minutes left. So if we can just get we have a few more minutes? Okay, terrific, terrific. So yes.
Hi, Darla Spence Coffey from the Council on Social Work Education. And I just wanted to bring the conversation back to a critique about the notion of resiliency, because we throw that word around a lot. And I know that, in the past, we would study people who had been through horrific events and looked at the ones that were doing a little better than the others and figure out, let's figure out what worked for them. And I've, we should not need to be extraordinary to be good healthcare providers or good, so that's the kind of thing. It's like, let's examine the extraordinary. So, but it is a term that's used a lot. And so I'm just wondering, because language means so much, if not resiliency, how can we rephrase that? How can we think differently? So it's kind of along the lines of what Pat's saying. Is like, instead of weakness, let's talk about vulnerability. And there's some different images that we can attach to that. So if not resiliency, then what?
I don't have a concern about using resilience. It's the overuse of it. And it almost becomes, if you didn't survive the trauma, there was something wrong with you. And maybe there was something wrong with the system. So So what I'm really saying is I don't have a better term than resilience, but when we're using resilience as the intervention, meaning that it will be okay. Other people have survived this, and they come out whole. But if we have to, for those who are resilient, there are always those who are not. And so they are equally deserving of our attention and our care. So I think that's where I was aligning the conversation with. And I was sort of thinking back to how culture relates to this, and historical trauma in particular, as I was listening to Angelo and saying that he could expose his vulnerabilities. I don't know that I could expose my vulnerabilities as an African American woman, when exposing those vulnerabilities may deny me some opportunities because of the intersectionality and the differences in leadership expectation of men versus women. So I think that's sort of where I was headed, that conversation. So I'm a firm believer in resilience, but when we expect people to overcome some of these isms and suck it up, and then I think we're doing harm by always elevating those who are resilient and not paying attention to those who did not make it. So
I think that's a really critical point as we're talking about curricular, interventions. We're also need to be mindful of the hidden curriculum of what's actually valued in institutions, and the way in which there are certain and different and differential expectations of behavior and what counts as leadership behavior across gender, possibly across racial lines, indeed across racial lines, ethnicities, religion, etc.
And I would postulate that the use of the word resiliency is actually a reflection of an end result, right? And so when Ebola came up, we could see who is immune to Ebola, what individuals are immune, and let's try to figure out about them, what made them immune, and then let's build something to do that. And what we actually did was get to prevention, right? Prevention is actually the core. So resiliency is important, and you need to have some level of resiliency when it's necessary. But when we've reached, when an industry has reached a situation that you almost given up and say, we all have to be resilient, as opposed to focusing on the preventive side of things.
Absolutely.
And restructuring
Systemic
at the
change.
beginning, it's a whole different conversation.
Absolutely.
You still need resiliency, but that should be the moment that it's not the norm. And we're reaching a place, and even the conversation today, where we're almost accepting a norm of what's happening, as opposed to focusing on the prevention side of things.
Just an extension on this topic of resiliency. I recall when we were, during our planning meetings, thinking about what's the pie in the sky? What does success look like? And we were talking about resilient organizations. And for me, I thought, well, that to me, in my mind, and I think I commented on this earlier similarly, that an organization that's resilient is one that has reactive processes in place, expecting that people will have good days and bad days and vulnerable moments, and has a place to go to react and to bounce back. But a resilient organization also has a place to grow, a place where you feel happy, where you feel mission driven, and where you can grow in your strengths. So I'm just pulling back to think about resiliency even at the organizational level.
And I think we have time for one more? One? No more. Okay, no more. Okay, so no more.
Okay. So I'd like to take this opportunity to thank everyone, Kimberlyn, Sandra, Angelo, Tracy, Jason, Katie, and John. This has really been interesting. It clearly could go on for another few hours. So thank you so much, all of you. Excellent. Great.